reach out right here. Good. Hey everybody, it's Dr. Randy, Kalkstein Family Chiropractic. We have Shauna in the office today, our massage therapist. We're gonna adjust her for left shoulder pain, Shauna, neck pain. She has a rib out in her thoracic spine, in the area between her shoulder blades on the left-hand side. And we'll adjust her full spine. We're gonna focus on neck, left shoulder, rib. I remember before we had did a video with her before because we adjust her for her. Did they diagnose you with Meniere's? But just dizziness. Did you ever get diagnosed?
No.
Did you ever see anybody else? But the adjustments seem to be helping her with that kind of stuff too, with the dizziness. So anybody, obviously neck and shoulder pain, we all know with chiropractic, I hope you do, but dizziness, rib pain, pain between the shoulder blades, very effective. Chiropractic adjustments are very effective for. Do not take your over-the-counter stuff, your Advils, your Tylenols. You're just masking the problem. You're not getting to the root cause. The root cause of those problems, 90%, not 100%, 90% of back pain is mechanical, joint mechanic related. I mean, mechanics of your spinal joints they're either misaligned or they're not functioning properly. Adjustments, what we do with palpation is find where the joint mechanics are off, where you're out of place, where things are restricted is really what happens. And then with some gentle, light adjustments, restore proper alignment to your spinal joints. That allows the muscles in the area to reset. It brings down pain, it brings down inflammation, all the good things that we want. Improves range of motion, improves your functional capability. So you're actually getting to the root cause, not just masking the symptoms. So you'll get out of pain quicker, it'll be less likely to come back, and you'll be able to function at a higher level in your life, whether it be for your job or at home or whatever you want to do. Because what happens with people is if they just mask the pain all the time, those spinal joints will decay over time. Scar tissue will build up in them, and you'll lose range of motion and strength and all that kind of good stuff we want. It isn't age that causes that to happen to people, it's joints that are under stress. Joints that have broken down, that have wear and tear build up. So adjustments prevent that process. Just taking over-the-counter meds or pain meds or just ignoring it won't. You'll actually be left worse off in the long run. So you're always better off to get things fixed the right way the first time. So remember, we have 3 offices. We're here at Irwin. X-rays at all the offices. We have one in North Versailles, the border of North Huntington, North Versailles, further down Route 30, and then my sister's in Monroeville. We'd love to see you at one of our offices. All right, Shauna, you ready? So we're going to start off, like we do with a lot of our patients, we're going to do some soft tissue trigger point therapy, we call it, or muscle work, which is going to help loosen her up for her adjustment. And it's also going to get rid of some of the knots that build up in some of the bigger muscles. This is a problem we see every day. Super common problem. People who sit too much or sit for a living, that's part of your job, you have to. You're at a computer or you're on the phone and your shoulders become rounded. Puts a lot of stress back through here. It's a super common problem. So we work all those knots and all that inflammation, we work out with some light soft tissue work. Not digging into her muscle because that would make her super sore tomorrow. It's a light technique, it's a light pressure. Along, in this case, I'm on her trapezius muscle, her left trap, and then we'll get down on her left rhomboid, and we'll just hold a little ischemic compression, it's called. Just hold some pressure. We're going to adjust her where her thoracic vertebrae articulate with her ribs on the left-hand side too. She's having some problem taking a deep, like when she takes a deep breath, she's getting like a little bit of pain there. That's a sign that the rib heads might be just need adjusted. Take a deep breath in for me, Shauna. Exhale all the way out, nice and easy. Good, good, very good. Get a little release there. Same thing, take a deep breath in this way. Exhale, let your shoulder drop. Good, you okay? Soft tissue. Are you okay? Hold that up. Typical adjustment in the office is going to take about 10 minutes with me, 10-15 minutes. We'll do some adjustments, we'll do some stretching, some soft tissue work. We try to keep the office, people are busy, we try to respect your time and keep people moving here. So not going to be in my office for an hour waiting and on a lot of therapies and on
stim and ultrasound. It really isn't doing too much. We kind of get right to it, get right to the problem. That's just how we practice, and I think that people respond really well to it. Go on your back for me. Take all insurances. Come back to us a little bit. Just relax your shoulder this one. So here's your neck adjustment. Remember, the left side was bothering her more. We're going to start on that side. She's out right here. Good. Same thing. Relax your shoulders this way. Good. Nice and easy. What that does is if you probably can't visualize, that takes that joint through its proper range of motion and just a little bit more. It breaks through restriction and scar tissue buildup. When you go just past the end range of motion, you get a cavitation. That's the popping sound. That's just a gas. Her bones aren't moving there. Just a pressure change, so gas gets released, and that causes the sound, just like your knuckle. But it's to a joint that needs adjusted, not one that's already movable. I like to do a lot of decompression, so we use a towel. Pick your head up for me. Relax it all the way down. Just let your shoulders relax. Good. Use a nice pull here. This decompresses her neck and upper thoracic spine. It's good for the discs in between the vertebrae. Good technique, and sometimes we'll give it a little bit of an extra. You're so light, put it right at the table. Okay, mid-back. We do this mid-back adjustment. Cross these arms, take a deep breath. Exhale, roll back on my hand. You can see my hand there, and just a little bit of it. Good. That was her rib. Go on your side face to me. Let's do her low back while we're at it. Nice deep breath, John. Exhale. And other side. Deep breath in. Exhale. Good. And then face up, we'll do her shoulders. This ball and socket, this glenohumeral joint here, the humerus, top of the humerus can slide forward. It happens with everybody, your shoulders get rounded. So I'm coming around with this hand, let this arm sort of drop. And that just little pop just resets that joint, this one here. There we go. And she's done. So we may do a little more soft tissue, a little more stretching. I'll have her do some stretching like so, back and forth. But adjustment-wise, she's for the most part done. Again, neck, shoulder, left rib pain, okay, left neck pain, headaches, dizziness. So all those adjustments are effective for those things. So again, we'd love to see you in the office, 3 locations. Give us a call. And thanks for watching.